All the photos shown here belongs to their respective owner. I or the channel does not claim any rights over them. Hi everyone, I am Shahan and today in this video I will discuss about Plummer Vinson syndrome. Plummer Vinson syndrome is a very important topic, and so many times it is asked in examination like NEET PG, DNB, and it is also asked in AIMS examination. So this is very important, and recent questions also came in PLAB and USMLE examination. So let us learn about Plummer Vinson syndrome, and there are very few videos which are available regarding Plummer Vinson syndrome in YouTube, so I thought why not make a video on that. So what is Plummer Vinson syndrome? Plummer Vinson syndrome, let us learn about the definition first. Plummer Vinson syndrome is a rare disease characterized by difficulty swallowing. So it is a very rare disease and it is characterized by difficulty swallowing. That means the person is having dysphagia. That means the person is having difficulty in swallowing. Iron deficiency anemia, and another important feature of this disease is anemia, and that is iron deficiency anemia. And also glossitis. What do you mean by the term glossitis? Glossitis means inflammation of tongue. Itis means inflammation and glossitis means inflammation of tongue. Okay, so you have all this difficulty in swallowing, you have dysphagia, you have iron deficiency anemia. So basically the patient will look pale, so you can understand it is anemia. So these are the features: difficulty swallowing, IDA, iron deficiency anemia, that is the patient will look pale, and inflammation of the tongue, that is known as glossitis. And along with that you also have cheilosis. Now what is cheilosis? Basically cheilosis is the ulcer which is occurring at the corner of the mouth. This is also very important in case of the PVS, Plummer Vinson syndrome. And along with glossitis, cheilosis, you also have the feature of esophageal waves. These are the waves that are generated inside the esophagus, and that is why the patient suffers from dysphagia. Whenever the persons try to swallow something, it is very painful. Now this picture is showing the three important things, that is dysphagia, iron deficiency anemia, and esophageal waves. Why I am showing you these three only? Because this is the triad of the Plummer Vinson syndrome. So always remember this triad, because so many times examiners ask this question: what is the triad of the Plummer Vinson syndrome? The triad of the Plummer Vinson syndrome comprises of dysphagia, iron deficiency anemia, and esophageal waves. So this is the triad. Now look at this picture. Plummer Vinson syndrome is also known as Patterson-Kelly syndrome. Basically Plummer Vinson syndrome is the term that is given in United States. Basically these are Plummer and Vinsons are the staffs, or they are the physicians in the Mayo Clinic. And another terminology for this disease is Patterson-Kelly syndrome. Patterson-Kelly syndrome. This is the same disease as that of the Plummer Vinson. So who are they? Patterson and Kelly are also physicians. They are from UK. So these are the two names of this disease: Plummer Vinson syndrome and Patterson-Kelly syndrome. Same disease. Okay. So examiner may confuse you by giving the name Patterson-Kelly syndrome. It is the same thing as that of Plummer Vinson syndrome. Always remember, Plummer Vinson syndrome is given in USA, and Patterson-Kelly syndrome is given in UK. The same thing. Okay. Now you have the three important features which is shown in this slides. Number one is dysphagia. Dysphagia is said to occur because of the presence of post-cricoid wave. Now you can see the left side, the esophagus is shown, and it has post-cricoid wave. Sometimes they ask you the wave is present at which position. So it is post-cricoid wave. Post-cricoid wave. Another is glossitis. Glossitis means inflammation of the tongue. Inflammation of the tongue. Next, you can see the image also in the second, glossitis, inflammation of the tongue. And number 3 is koilonychia. What is this, the terminology koilonychia means? Koilonychia means that spoon-shaped nail. You can see the nail of this person, this spoon-shaped. So it is koilonychia. Don't worry about the images, it may be small, but in subsequent slides I will show you the real pictures and it will be large picture. So be with me. You can see this picture. This is a picture of esophagus, and with the help of a small camera you can see this pictures is taken. Now picture A you can see the esophagus, and picture B you can see the radiology. Picture C how the esophageal wave is there, and picture D is actually how it is corrected, after correction how it looks. So in this way you can understand this is esophageal wave, and esophageal waves occurs at post-cricoid position. Sometimes they may also ask you that post-cricoid esophageal wave. That is a very important feature of Plummer Vinson syndrome. Now look at this picture. This picture is showing glossitis, that is inflammation of the tongue, and this is also very important feature for Plummer Vinson syndrome. Now look at this picture. In this picture, A is showing the esophageal wave in radiology, B is showing the cheilosis, that is at the angle of the mouth you can get the ulcer, you can see in B, and in C you can see the glossitis, inflammation of the tongue, and in D you get koilonychia, that means the spoon-shaped nails. So these are the 4 important features of Plummer Vinson syndrome, which is very important. This is another picture of koilonychia, spoon-shaped nail, that can be found in Plummer Vinson syndrome. This is another picture. You can see how the nails are looking like a spoon-shaped. It looks like spoon. This picture you can see how prominently you can find that the nails are spoon-shaped. So this is koilonychia. This is a feature of Plummer Vinson syndrome. Now tell me which feature is shown in this picture. This is cheilosis. Yes, cheilosis means the angular ulceration. You can see the angles of the mouth is ulcerated. There are ulcers, there are so many ulcers in the angles of the mouth. So this is known as cheilosis. This is known as cheilosis. This is one of the important feature of Plummer Vinson syndrome. So wake up guys, don't forget to revise Plummer Vinson syndrome. Let me revise once again. Plummer Vinson syndrome is also known as Patterson-Kelly syndrome. Plummer Vinson syndrome is the name given in USA, and Patterson-Kelly is the name that is given in UK. So they are same. Plummer Vinson syndrome, Patterson-Kelly syndrome. There is another name for this disease, and the name is sideropenic dysphagia. Sideropenic dysphagia. This is actually representing the IDA, iron deficiency anemia. So it is known as sideropenic dysphagia. Another is thing which is very important is post-cricoid wave. So I told you about the esophageal wave, and that is post-cricoid in the position. Esophageal wave, post-cricoid in positions. All these points are very important, like Patterson-Kelly syndrome, sideropenic dysphagia, post-cricoid wave, and iron deficiency anemia, glossitis, koilonychia. What is the meaning of the term koilonychia? Spoon-shaped nail. And also what is the treatment? That is balloon dilatation. Treatment is balloon dilatation. So these points are very important. So we have revised Plummer Vinson syndrome, which is also known as Patterson-Kelly syndrome, sideropenic dysphagia. It is characterized by dysphagia, that is painful swallowing. Along with that, you get esophageal wave at the post-cricoid region. Along with that, you get the IDA, iron deficiency anemia, glossitis, koilonychia, that is Poinsett nails, and the treatment is balloon dilatation. Now tell me one thing which you guys may have forgotten, that is, what is the triad of this disease? The triad of Plummer Vinson syndrome is esophageal wave, dysphagia, and iron deficiency anemia. Now let me discuss about a real case. Now this is a real case. You can see A is showing the inflammation of the tongue, inflamed tissue of the tongue. B is showing the paleness in the eyes. So B is actually showing the anemia, and C is showing the cheilosis, that is angular ulcers at the mouth. So all these three are representing the Plummer Vinson syndrome. This is a case of Plummer Vinson syndrome. Look at this. This is another case of Plummer Vinson syndrome. In A, you can see the patient is pale in its eyes, and next is the inflammation of the tongue, glossitis, and number C is cheilosis, so angular cheilosis. So all these three clinical features, that is pallor in the lower palpebral conjunctiva, glossitis, inflammation of the tongue, and angular cheilosis, that is angular ulceration at the mouth, you can understand this is the case of the Plummer Vinson syndrome. So this is the end of this video, and if you like this video, make a thumbs up and please subscribe this channel. We have many videos on medicine, so you can go to the playlist and watch all the videos of medicine, watch all the videos on PLAB USMLE series, and also watch all the videos on pathology. You will have a great knowledge from this channel, and if you like this channel, please share this channel with all your medical friends so that many more medicos can get help. Thank you so much for loving us and supporting us. We have already completed our 1000 subscribers, and 1k followers are also completed in our Instagram. Thank you so much for watching this video, and if you want to join us in our Instagram, you can join our Instagram handle Dr. Shahan's class, DrShahansClass. Thank you so much for watching this video. Have a nice day. Bye bye.